Kevin, do we have Commissioner Scouten back yet?
We do not, Madam Chair. I'm keeping my eye out for him.
Okay. Well, it's 10 o'clock. Why don't we get started? Welcome everyone to the Tuesday, December 8th, 2020 Washington County Board of Commissioners meeting. Clerk Moss, roll call, please.
Thank you, Madam Chair. The Board of County Commissioners for Washington County, also meeting as the Clean Water Services Board of Directors and all other county service districts, is now meeting in this regular session, December 8th, 2020. Commissioner Willie?
Here.
Commissioner Treese?
Here.
Commissioner Rogers?
Here.
Chair Harrington?
Here. And there's Commissioner Scouten.
He should be on screen momentarily.
Yeah. Hello there, Commissioner Scouten.
Hello, everyone. Okay.
Great.
Slight delay
we were
here.
just taking the roll. No worries. All righty. Welcome, everyone. The first item on we have no agenda changes for today. The first item on our agenda is oral communication. Mr. Moss, do we have anyone signed up?
We do not for this section, Madam Chair.
Commissioner Willie, did you have something to say, or are you on a phone call?
No, I did not. I was giving some instructions to my landscaper who is making a whole bunch of noise right now, so I'm going to stay muted.
Okay, no worries. I just wanted to make sure I wasn't missing something. It's all part of the virtual style of things. All righty. Next, we'll move on to the consent agenda. Today's consent agenda is pretty straightforward. I'm not sure if we've, in my time here, ever had a consent agenda with just one item before. And it is from support services. What are the wishes of the committee regarding today's consent agenda?
I move that we approve. Second.
Yeah, either way.
We have a motion from Commissioner Rogers, seconded by Commissioner Scouten. All those in favor of approving today's consent agenda as moved, vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, commissioners. Next, we'll move on to presentations. We are looking forward to some updates from our staff today.
And we should have Marnie Kyle momentarily for you, Madam Chair.
There she is.
Here I
Hello,
am.
Marnie, and we have your presentation as well. Welcome.
Great.
The floor is yours.
Okay. Thank you, Chair Harrington and board. Carrie Beck is going to be joining me after about 10 slides. So I'm sure Kevin will let her in. I'm going to go through my slides fairly quickly because they should all be very familiar with you. Just updating the numbers for everybody. So let's go ahead to the next slide. So these are the cumulative numbers since February 28th for the state of Oregon. So we have had a total of almost 86,000 cases of COVID-19 in our state. Our current statewide case rate is 1,922 per 100,000. So you'll see in a couple of slides that number just keeps going up. We have had over 1,000 deaths, unfortunately, in Oregon since this pandemic started. And our hospitalization, the average number hospitalized per week is gone up pretty significantly in the last few weeks. We're now at 238 per week. Next slide. We'll move to our Washington County numbers, and for a comparison, I gave you last week's numbers, and you'll see that we've had a 16% increase in the past week in the number of cases. We're now up to just under 12,000 cases in Washington County, with an additional 307 presumptive cases. In Washington County, we've had 584 people hospitalized since the beginning of the pandemic, and 109 of our Washington County community members have lost their life to COVID. Still have a significant number of outbreaks that we're managing in our public health response. 39 long-term care facilities, 8 additional congregate care facilities, 10 workplace, and 7 school daycare camp related outbreaks that we're managing. Next slide. So this is the epi curve, as we call it. We've been showing you for the last several weeks, and you can see that even after entering the freeze, our numbers continue to go up. We do anticipate that they will continue to go up because we may not be seeing the full impact of the Thanksgiving holiday yet, and we expect those numbers to continue to go up. So next slide. Just to ensure that we remember that this virus is impacting all of us, but it is having a significantly disproportionate impact on our Latinx community. There is a small glimmer of hope in this, because I think you'll remember in the past we've had as much as 52% of our cases being Latinx. And that number is slowly, ever so slowly and slightly beginning to decline. And what we've learned is that also the percent positive testing is starting to decline in the Latinx community. So we're hopeful that the focused testing and the focused outreach, education, and information may be beginning to have a slight, slow, positive impact for that community, but it really is early to say that. But I just wanted to say there might be a little bit of a glimmer of hope here. Next slide. So just to remind you, because it's still pretty new, we have moved to this new process or standards for determining what a county's risk level is. And it's really disease activity metrics that are designed to help us to identify what is our risk of spread within the community. There are other metrics that we're watching just for additional data context. But Washington County continues to be in the widespread or extreme risk category. And we have to remain in that category at least 4 weeks before moving on. So that really at this point puts us well beyond Christmas holiday. Next slide. So this is the disease metrics that we're using. And as you can see, the rate in order to go down to substantial spread or to the high risk category. So even moving one category down is 100 per 100,000, between 100 to 200 per 100,000. So you'll see, and we can move to the next slide. Also, test positivity needs to be below 10%. But you can see in this slide that all 3 of our counties are moving in the wrong direction. So Washington County moved from 411 per 100,000 to 515 per 100,000 in the last week. You can see that Clackamas County also went up, and Multnomah County actually had a slight decline, but it's as you'll see, we can actually move to the next slide. We continue statewide to have data reporting issues, and we're continuing to have problems with the state testing data collection and OPRA data collection, which is where we put our case reports. Just with the pure numbers, the case counts, the number of labs, the number of users, the state system has just become less functional. One of the things that OHA is doing to try to help the functionality of the lab testing database is to pull the negative labs out. So just reduce the number of data points that are in that database is something that they're doing to help. They're really hoping that will help level this out so that we can really see our metrics on a day-to-day basis again and have confidence and not be behind on data input or behind on lab processing. So next slide. Just as a reminder, the West Coast Travel Advisory continues. The governors in all 3 West Coast states are asking people if they travel out of state for non-essential work that they self-quarantine for 14 days. And really, essentially, we're asking everybody to avoid any non-essential travel at this point. Okay, next slide. So this is, I think, what you've all been waiting for. So a lot of us across the nation here locally are really interested in vaccination and when are we going to have vaccines available? What's our plan for distributing the vaccines and getting them to our healthcare community, our high-risk community, our BIPOC community. And so I see Carrie Beck is here. So I'd like to introduce Carrie Beck. She's a senior program coordinator with the Public Health Division, and she's really helping to lead our testing and vaccination strategies. And I'll say as a little side note, Carrie and Tricia and I all work together in Clark County. So public health is a pretty small world. So we have another really fabulous find for Washington County. We're thrilled to have Carrie here. And I am going to mute myself and turn it over to Carrie. So welcome, Carrie.
Thank you so much, Marnie. I'm happy to be on the call. Yes, seems like many years ago, Tricia trained me to manage the WIC program in Clark County. So I've known Tricia and Marnie for quite a long time, but it's good to be reconnected. And it's been great working for Washington County. So yes, today I'm going to give an update on vaccination. There's been some exciting news coming out in the last couple of weeks, and I'll try to pull that all together and give you some brief notes about what are the challenges of the vaccines, the safety and the effectiveness of the vaccines, and then what is the timeline for receiving them and getting them out, and of course the priority groups. Next slide, please. So the 2 vaccines that we've heard the most about that we are anticipating soon are the Pfizer vaccine and the Moderna vaccine. One of the challenges, probably the most significant challenges, is that these 2 vaccines have different needs for temperature storage. The Pfizer vaccine requires an ultra cold storage temperature of -70 Celsius. And the Moderna vaccine requires storage in a regular freezer. So a little bit easier. They also differ in the amount of time that between the first and the second dose, which will likely present as somewhat of a challenge when administering to the population. The Pfizer vaccine is a minimum of 21 days apart for the first and second dose, and the Moderna vaccine is slightly longer, 28 days. So another challenge and an opportunity in our communication is to ensure that the public knows about the common side effects. These have been shown in clinical trials to be similar to what is experienced, say, during the flu, or I've also heard after receiving the shingles vaccination. So things like a sore arm, achy muscles and body, fatigue, etc. Next slide, please. So taking a look at the safety and the efficacy of the vaccine, there are a number of things that really do tell us that this is a safe and effective vaccine. Number one, looking at the clinical trials that were completed by Pfizer and Moderna, there were 3 clinical trials completed for each, and they were both fairly large population groups and fairly representative of our general population. The studies used the gold standard, which is a placebo-controlled and double-blinded study. So a recipient would not know whether they received the placebo vaccine or the real vaccine. And then it's also important to mention that even after the vaccine is disseminated into the community, that there will be continuing surveillance and observation of side effects and efficacy. So data will be continued to be collected. And then second of all, remembering that there were a number of independent, transparent oversight groups monitoring the clinical trials and approval of the vaccines or eventual approval. For instance, the FDA committee known as the VRBPAC will be the committee who reviews and potentially grants the emergency use authorization of the vaccines. The ACIP group also reviews the clinical data and recommends priority populations, which we look to for their recommendation. And then you may have heard about the Western States Scientific Safety Review, which Oregon has joined with California and Washington State. And we do have 2 physicians from Oregon who are on that group. And we do not expect that this review will delay the availability of the vaccine. Next slide, please. So here's a look at the current timeline starting in November of this year, when we did hear the results of the clinical trials from the 2 vaccines that are leading, Pfizer and Moderna. They did report 95 and 94.5 efficacy for those respectively. Going forth, we expect, we do know that the VRBPAC committee to potentially approve the emergency use authorization is going to be meeting in 2 days, which is very exciting. A week later, they will be meeting to discuss the application for the Moderna vaccine. And then just last week, we heard from the governor's office the first announcements for which vaccines will be arriving in Oregon and how many of each one. So here I've listed out which vaccine, how many we expect to receive. And then Oregon Health Authority has stated that they expect that all groups in the priority population of 1A will be fully vaccinated by the end of January. So let's talk a little bit more about those priority groups. Next slide, please.
Can I just interrupt here for a second, Carrie? Just because I'm
absolutely.
I just want to make sure that as members of our public watch this on YouTube later, in this timeline, when you say Pfizer, or when the slide says Pfizer second doses ship and Moderna second doses ship, You mean the second set, not that the vaccine itself, that humans have to get 2 doses? Or which is it?
If I understand your question right, when it says second dose, it is the same product as the first dose, but when it says second doses, those will be intended to be administered in the population that already received the first dose.
Okay,
And
so that's the point of clarification that I needed, that both of these vaccines require that someone be injected twice.
Yes, and I can see how that could be misunderstood. So thank you for pointing that out. And yes.
I do have a question, if I can, since we're kind of have a couple of questions.
Sure, go ahead.
In terms of the interval, what I would be more concerned about is you mentioned the minimum time between the dosage. What is the maximum time for that second dosage to actually be effective? Because I know there was an issue with the shingles vaccination that could be no more than, I think it was like 6 months as an example, but there was a real shortage of the vaccine, and there were concerns sometimes that people who got the first dose would not be able to get the second dose in a timely fashion. Is that going to be an issue with this vaccine?
I could see it as a potential issue in all of the information that I have read. I have never seen an indication of what the maximum number of days is, and it's very possible because of this, very short turnaround for clinical trials to be conducted, that information is just not available yet. I will do some more research, and if I find out the maximum or amount of time, I will certainly get back to you. And we are more concerned about the population who received the first dose not coming back for the second dose, because then they would not receive the maximum amount of immunity than they would if they had received both doses.
Okay, thank you.
A very good question. I'm sorry, I can't fully answer.
More to be revealed later, I guess.
Yes, I'm sure it will. Are there any other questions I can answer now? Okay, so let's take a look at these priority groups. They have been divided into 3 phases. This is a look at phase 1, where we know that we will have limited doses. We have divided this into, actually the ACIP committee has divided this into phase 1A and phase 1B. So the first groups that are intended to get the vaccine will be the paid and unpaid healthcare workers who have the potential for direct or indirect exposure. We know that in that group, there are about 350,000 healthcare workers in Oregon. Also included in phase 1A are the residents and staff in long-term care facilities. And I will talk a little bit more about later, but you may have heard that the federal government has a partnership with CVS and Walgreens to fully administer vaccine to these long-term care facilities. And we do know that 100% of our skilled nursing facilities in Oregon enrolled in this program with pharmacies. We also had a very high rate for enrollment in Oregon. So phase 1B will be other essential workers, and those including teachers, food and agriculture, police, etc. And then also those who are at risk for severe illness from the disease, and those who are 65 and older. So we anticipate that for the administration into these population groups, that hospitals will be the primary site for vaccination. for several reasons, manage the ultra cold storage requirement. And we want to make sure that we're maintaining that hospital workforce to deal with or to provide care to those who are hospitalized. Next slide, please. Here's a look at phase 2 and phase 3, where we will continue to get doses of vaccine and reach more and more of the population. So in phase 2, we will continue to work through vaccinating all of those groups in phase 1. And then we will be focused on critical populations who are more affected by the disease, have typically been underserved in our communities. These would include BIPOC populations, incarcerated, houseless communities, other congregate settings, uninsured, underinsured, etc. And we've listed out here where those people will typically get vaccinated. They will include places like your doctor's office, pharmacies, federally qualified health centers, which include Virginia Garcia and Neighborhood Health Center in our county. Phase 3, we will continue to vaccinate, be reaching the phase 1 populations, these critical populations, and then where many of us are located in this general population. Oregon Health Authority has said that they do believe they will have enough vaccination for everyone in Oregon to receive it by late spring. Next slide, please. So here's a model looking at our vaccination plan using Swiss cheese. We like it because it shows the different players who will be providing the vaccine to which groups and how they will be working through time. So hospitals, like I mentioned before, will be the first people who receive the vaccine and administer, focusing on their staff and their patients. So, and then moving on there, we also know that pharmacies will be one of the first organizations who receive the vaccine. And those will be places like CVS, Walgreens, but then other pharmacies as well. They will focus on long-term care, but then the general population will be able to go to a pharmacy and get their vaccine, and many do for other vaccines. So this will be a continuation of that plan. We have contracts with emergency management systems, including our ambulance services, and we can utilize those contracts to send them out to populations who have difficulty accessing the vaccine through other means, and priority groups that we want to make sure that we target. And then where do we come in this? We as public health, we anticipate that we will be receiving vaccine. We will be setting up locations to administer that and working closely with our partners. We know that we also have partners that we work closely with, including places like emergency medical services, first responders. For example, we know that Tualatin Valley Fire and Rescue will be administering vaccine to their staff and potentially to the public. So this is a general look at where we are now in our planning. Next slide, please. So again, what is our role? It's particularly important that we ensure access of the vaccine to at-risk and disadvantaged populations, taking a particular, focusing particularly on our BIPOC communities. Also those who have limited access to, say, a primary care provider in their healthcare system, pharmacies, or these other vaccine delivery systems that I have talked about. And then those, of course, living in poverty who generally have, would have difficulty time accessing this vaccine. We know that we will likely utilize our Medical Reserve Corps volunteers. to help us administer the vaccine. And we believe that we would be vaccinating a fairly small, directly vaccinating a fairly small percentage of our population in the county, 10% or less, given all these other means of administration that we will be using in the county. Next slide, please. We will be coordinating very closely with our state, our regional, and our local partners. Specifically, our federally qualified health centers and other community-based organizations. We will be looking to them to help us best reach out to those priority populations that I've mentioned. That's a really important relationship. We will also be working closely with our city and county emergency managers to look at potential dispensing locations spread out in areas that are ideal. For instance, I'm working closely with a City of Hillsborough planning group for the vaccine, where we're looking at potential sites for these locations. In addition, we will be working closely with OHSU on the Hillsborough Stadium testing site to also be utilized for vaccination. So this is a large drive-through site located in at the Hawks Stadium. Next slide, please. So how are we engaging with the community to really understand what concerns the community has and able to address them? We want to make, we believe that equity is really the major focus of our planning, and we will do that and ensuring that the BIPOC communities have access to the vaccine. We know that in the Oregon Health Authority's vaccine distribution plan, they have also set equity as the main focus for them. And we will use this as a building block, but then tailor it for our communities. We want to certainly ensure that we use our communications to address the mistrust of public health and government and the vaccine, which we know is potentially of concern. Oregon Health Authority is forming and is convening a advisory group made up of community members, where they will be looking at advising the priority groups within priority groups. So say for phase 2 and phase 3, who should be getting that vaccine first. They're also conducting a survey with community-based organizations throughout the state to advise on the distribution plan. And then we in public health here in Washington County are working closely with the Office of Equity, Inclusion, and Community Engagement to help us facilitate these conversations with our community. So with those conversations with our community, our main goal will be to listen, to understand, to help understand to help those communities understand the vaccine and also how they will access the vaccine. And we will use this communication to inform our communications plan and our targeted vaccine plan. And we have a history of having strong relationships with our community-based organizations, of course, including our federally qualified health centers, who we have partnered in the past on flu shot clinics and have valuable learnings from that. So our communications planning is underway. Our communications department will be partnering with those in the metro counties on a regional plan. And that'll, of course, be influenced by our engagement with the community and the survey data that Oregon Health Authority is collecting. We will ensure that the information we have available is in the correct languages that it needs to be. And we will use our regular weekly newsletters and our other regular communication routes that we typically use. And we will also partner with those CBOs for getting the education into their specific priority groups. So that is a look at the vaccine. I will turn it over to Marnie. I could also take questions now, or if you'd like to hold them till the end, that would be fine too.
No, I think I want to open it up for any questions that you have for Carrie. My last two slides are the slides you're very used to seeing about continuing our precautions. So I want to give you all any time to ask Carrie any questions that you have.
Commissioners, questions, comments?
Yeah,
Commissioner Rogers, go ahead.
I certainly understand the complexity of rolling out these inoculations that I hope will work, and I understand the priority list, but I think we need to understand clearly what that's going to mean to the business community in terms of their testing. These folks, at least the ones I talked to, are on their knees. They're really not going to survive a whole lot longer with the closures. So are we at all getting information from the state that would tell us whether or not this inoculations, as I call them, will be done in such a manner that they'll be able to open up without either one of them occurring, or will they have to have some sort of testing or presenting of the cards, as I've understood? And I guess my concern is that we're going to say, well, we're going to give a lot of people who are essential workers shots in the near future, which is wonderful. We'll have a lot of people who are at high risk shots. That's wonderful. But are we going to say to our business owners, I'm sorry, without your staff showing some cards that you've been immunized, or that you have some mechanism to prove that your customer's immunized, you can't open up again. And so we could be looking at 6, 7 months, 8 months more. I guess I'm starting to really feel their pain. And so I'm trying to understand how all of that will be talked about, so that when we chat with these business owners, that we can clearly articulate what our plan is. So it's a little bit of rambling, but I think we need to understand what's happening.
Marnie, do you want me to take that, or do you want to take it?
Well, I can take a shot at it, and then you might have more information. But I think that the business activity and reopening of businesses is tied to the disease metrics, not necessarily to vaccination. Vaccinating people is a tool toward reducing the disease rate. It's a significant tool, but it is going to roll out rather, a little slowly. And then essential workers are people that are, in the beginning, I think, as Carrie described, it's healthcare workers, but it also includes other essential workers to get our economy back up and running over time. But I have not seen anything that is, I think that there's conversations about, will certain and I'm not saying even in Oregon, I'm saying nationally, there's conversations about whether or not proof of vaccination will be required for certain activities. For example, if you want to attend a large football game, do you have to, or a concert? But I haven't seen anything specific beyond that. And Chair Harrington had her hand up, and then I don't know if Carrie wants to add anything to that.
Why don't we have Carrie go first, and then I'll see if what I just heard from the state is worth mentioning. Go ahead, Ms. Beck.
Yes, I would completely concur with Marnie. I feel like I don't think there's anything else that I have to add.
Okay, so I just want to reinforce, I appreciated how, Marnie, you helped us ensure that we see the difference between the opening is based on the disease rate, not the vaccination rate. Commissioner Rogers, what I understand from the state, and I have to say this presentation is the first comprehensive view that I've seen about the rollout of the vaccination through our community. So hats off to you, Ms. Beck, Marnie, Kyle, and your team for putting this together for us. The state, the governor's office, OHA are receiving requests from various employers asking, how can we ensure that our employee set is early in the priority line for getting vaccinated? So our Washington County team does not determine that. Our team is very tightly connected with the state team as there is a national availability of the vaccine. So this is being handled and planned at the highest levels, as Ms. Kyle mentioned, at the national level and coordinated through the states. So our state leadership is very well informed on the concerns from businesses, small, medium to large, about ensuring that not only that their employees are vaccinated, but also that their customer base is vaccinated. We as a nation have gone through this through prior generations with vaccine rollouts, such as with polio. So there aren't specific plans yet for all of that. This plan is for the earliest availability of vaccinations. And I really appreciate the clarity so that there is this phase 1A and phase 1B rollout so that we are protecting our healthcare workers and our healthcare capacity, but also reducing deaths to the vulnerable members of our community first. Stay tuned. There will be further logistics information determined and rolled out in the coming weeks ahead, particularly in January and beyond, as there is more vaccination availability information. Sorry to get so long-winded on that.
I just want to follow up real quickly and say I've taken no exception to anything. I mean, I started out by saying that's fine. But I think we need to clearly say, because as much as we want to believe that there's this great trust in our friends in Salem, the metrics are changing so doggone much that people are questioning it. We have stuck by this. We stand by the science. We continue to stand by the science. And as long as we do it, what you said exactly, then I think we have a defensible case. If all of a sudden that changes at all, where we start saying, well, no, you're going to have to prove that you have had your staff immunized, or that there has to be some other kinds of comments. People are not going to be very tolerant. They've reached their capacity. They're unhappy. I've stood by, and I'm still going to stand by that our science, and I appreciate what you're doing. I believe what you said, and that's where we should fight if there's any other changes. So I've made my point. It's an issue that small business has right now, or perceives it.
Yeah. Commissioner Rogers, we understand and hear and empathize a lot with our businesses. It is a struggle. It's a struggle to balance, because economic health is also health in the long run for everyone. And then the other thing I wanted to add is that in addition to vaccinating people, even, no matter what metric we're using, whether we were talking about some of the old metrics or the new disease-focused metrics, risk metrics, the strategies that we have been talking about over and over and over are the strategies that will help get our businesses open again. I know they seem simple and they seem like they won't really work, but it's because we're not doing them. It's not because they don't work. So limiting our social gathering, wearing our mask, avoiding crowded spaces, those are the strategies that will get our businesses back open. And so, I don't want to underscore how badly I feel about the economics of this situation, but if we all pull together while we're waiting for these vaccines to become available and to get those vaccines in our arms, these strategies do work. And so I think if you and others can help us to share that with everyone, that will get us open quicker.
This is Commissioner Scouten. On the 1A and the 1B, could you go over briefly again those timelines for 1A and also for 1B?
Yes. Could we go to slide number 14, the timeline? So for those groups in just phase 1A, which are the healthcare workers and long-term care facility residents and staff, the goal and statement by OHA is that by the end of January, that 1A group will be fully vaccinated. So first and second dose.
Okay.
And then for phase 1B, other essential workers and those at high risk, including those 65 and plus, I have not seen an indication from OHA about when those groups will be fully vaccinated. But they do believe by late spring that everyone in Oregon will be vaccinated. So my guess is we will be shooting for phase 1B. If you go to the next slide, phase 1, this phase 1B, we're probably looking at end of March. That's my guess. Jump in, other Marnie, if you have a different idea, but that those will certainly be the goals, early spring, mid-spring.
Yeah, the only thing I would clarify is when we say, when Carrie says that OHA believes everybody will be vaccinated, it's everyone that wants vaccine will have had access to vaccine by that point in time. There isn't any that I am aware of. There's no requirement that you absolutely have to get vaccinated. So it's really trying to convince people that they want to get vaccinated at this point.
Okay, so for those who want to be vaccinated, the first group 1A, the goal is by end of January to have those groups, people in that group, with both doses. The second group, the 1B, we're talking about March, and then everyone that is interested and wants to will be vaccinated by, did I hear the end of spring, April, May?
I've heard late spring.
Yeah.
Go ahead, Marnie.
Okay, so
yeah.
May, early June.
Yeah, and I would just remind you, commissioners, that these are all estimated numbers based on the ability for these vaccine manufacturers to get the vaccine manufactured and out to us. But assuming that everything goes as planned, that's the hope.
And those are the estimated timelines for the three respective groups at this time.
Yes.
Okay, thank you.
Yep.
Commissioner Willie, you indicated you had questions earlier?
Yeah, just so when you get the vaccination, how long before it's actually effective? So you have some of those symptoms that you indicated, but how long before it really, I guess, takes effect?
Yes, I heard this answer to this question the other day, and I'm trying to remember. I believe I heard 2 weeks. I need to look that up and make sure, but it's fairly quick when you start to see some sort of immune response. So I'll look that up and make sure that I have the correct answer. But and this would be after the first dose. You would be looking at some sort of immune response within a few weeks. And then I believe after the first dose, the immune efficacy was around the 60%, and then jumping to over 90% with the second vaccine, with the second dose.
Commissioner Treese, do you have any questions or comments?
No, I just appreciate the information, and I just want to reemphasize and make sure that we reemphasize always that the business reopening piece is tied to the metrics, not to the vaccination. So the metrics of the disease. That's my big concern, that we continue to communicate that to our business community.
I thank Commissioner Willie for his excellent question. As a follow-up to that, are you saying that after the first round, that roughly 60% of the population will then, within roughly a 2 to 3 week time period, be immunized from COVID? Which would that mean that 40% of those who get the first dosage could still get COVID in the intervening weeks or months before their second dosage?
So the persons that received the first vaccine within a few weeks would have protection of around efficacy, would be protected about 60%. So yes, they still would have a considerable chance of becoming ill to the virus. So that's an important point, is these vaccines there is not data around whether you are a silent carrier, but that whether you get ill from the vaccine. That's also an important point. So you have your chances of getting ill after the first vaccine are still considerable, and that's why you want to get the second dose.
Any other questions from commissioners before I go?
Just to clarify, when you say ill, you're not talking about whatever side effects occur with the first dosage. You're talking about actually getting COVID-19 for about 40% of those who are immunized until you get that second dosage and get up to 90% immunization.
Correct.
Okay.
Correct.
Okay, so I'll comment now. First, I want to start by really complimenting you, Ms. Kyle, on the team that you have in place, both hiring a fantastic team, but also ensuring that they have visibility in their work to better inform us and better inform all aspects of our community. I really, really appreciate the excellence that you bring to Washington County, yourself, as well as through everyone on your team. You and your team have ensured that we've been informed by the science, that we understand the science, that we understand the plans and deployment, everything from testing, contact tracing, all of the supports you've been providing through our community, and now this new information and plans with the vaccination. I didn't notice the link to the presentation in our packet until we were here in the meeting. Really fantastic information. So thank you, Ms. Beck and Marnie, for all of that. I also appreciated earlier in the presentation how with the risk level you elevated for me that for reopening, that the disease rate risk level that will be in these states for at least 4 weeks until we're able to move to a lower risk category, still based upon the spread of the disease in our community. I heard loud and clear in the vaccination information that there is a role to be played with regard to messaging the side effects. You know, I'm pleased that you brought that to life because I have not had the shingles vaccine, but I know enough people who have that is a very strong vaccine and has caused people to essentially need a sick day to recover from the side effects the day after getting each of those doses. I also did not understand until Ms. Beck made sure in response to my question that I understand that these vaccines are 2-dose vaccines. So thank you for highlighting that as well. I appreciated the outline of the information as well as the questions from my fellow colleagues, and this aspect that for the general population, for phase 2 and phase 3 of these vaccinations, that clarity on the availability of vaccinations will be coming in the months ahead through January, February, March, and so forth. But that there is lots of assurance that every Oregonian, every person who lives here in Oregon will have access to vaccines, or we expect will have access to vaccines by late spring, which usually equates to the end of June when we talk about seasons for these types of things. So thank you for all that clarity. I do have a couple of questions myself. The first one goes to all the commissioners. Yesterday, I received an email from the state with a list of all 36 counties and where each county stands currently with the risk levels. This is the first time that the state has published the what they call the warning week as part of the cadence for this new model. Did all commissioners receive that? I'm seeing heads nod, thumbs up. Great, thank you. I just wanted to confirm that. The next is, I have a question for our public health team, Marnie, you or Ms. Beck. And I appreciated the reminder on the travel advisory that's still in place. I know I was looking into some potential safe vacation plans this winter for a ski holiday or to get away to a little sunshine and hiking elsewhere. But your presentation reminded me of the travel advisory. Is there any kind of time frame or estimate as to what risk level needs to be more prevalent in our state before folks like me who want to follow the protocols will have that to look forward to? Do you have any idea, any first thoughts?
Yeah, that's a great question, and I have not seen it tied to the disease metrics, but I will double check and let everybody know that answer, because it makes sense, but I haven't seen that.
Yeah, okay, terrific. Thank you. I would appreciate knowing more about that, and will do my part, not only in following that, but also in ensuring our community members know.
Okay.
Then the last question I had, your presentation today, Ms. Kyle and Ms. Beck, really did outline for me the information that Ms. Horner shared with the Tri-County chairs late yesterday. But I mean, we didn't get this comprehensive set of information at all. Rather, what I heard was the 10,000 levels and this phase 1A by the end of June, and the same message around hopeful availability by the end of spring. But I heard a very clear request of us, and it really comes down to Ms. Kyle, you and your team, and that is whatever you need as you play a role in the successful availability of the vaccine, in addition to our continued response. Please continue to work closely with our state counterparts. Ms. Horner was asking us as the county chairs, what more does your county need in order to work with us successfully on this? So I reiterated that this full board has every confidence in you and your team, but that I would do my part to pass on that call to action request. So it's not really a question as much as I could ask you point blank, is there anything you need for us to communicate or whatnot? But I think it's really a comment that if there's anything, let us know. I will do my part to get you what you need, as I fully expect the other board members would too.
Thank you.
One last point. There have been times when, Ms. Kyle, you've given us presentations like this at our board meeting. And in addition to the whole meeting YouTube video being available, our team has repackaged up just this segment on the COVID presentation. Ms. Angie, could that be done as well, so that the full public health team presentation of this really terrific material can be publicly available?
Yes, it can, Chair Harrington.
Terrific. Any last wrap up, Ms. Beck or Ms. Kyle?
No, I appreciate your time, Carrie. Thank you so much for doing this with me and sharing this great information. Just ending as usual with the plea for folks to really maintain their physical distancing, virtually meet with friends and family, because we know it's important to stay connected. Wear your mask whenever you're outside of your house, whenever you can't maintain completely the 6 foot of distance. And we are really recommending that folks avoid crowded malls, think about shopping online. And I think, not only does this protect our health and our lives and those of the people that we love, but as Commissioner Rogers reminds us, it also, these are the strategies that we all need to do, because we want our local businesses to survive and thrive and get open as soon as possible. So we need everybody's help to do that. And that, I think, is it. Thank you again.
Thank you both.
Thank you.
Thank you, and stay well.
Thanks. Bye-bye.
Thank you. All right, the next item on our agenda is under the action section, and it's regarding our county as well as Clean Water Services legislative agendas. I believe we have a staff presentation as well as some outside speakers as well. So if they could all get promoted appropriately for the presentation, that would be great. And I'm not sure who is taking it from here. Ms. Mazara Myers, perhaps?
That's correct. Thank you, Chair. And Kevin, I just want to make sure we have 3 outside preventers. It's Steve Palmer, David Haynes, and Pete Evich. So if you can just, while I'm speaking, get them up and running, that would be terrific.
Yes, I can.
Good morning. Great, thank you, Clerk. Good morning, Elizabeth Mazara Myers here as your interim government relations director. This is the final stage and moving forward, the proposed state and federal legislative agenda for both Washington County and Clean Water Services. Next slide. Our team today, of course, myself, our internal team of Aaron Doyle, Jajit Nagra, and Paige Spence. Federal lobbyists for Washington County, Steve Palmer and David Haynes. And then from Clean Water Services, Mark Jockers and Pete Evich. You will have a chance to meet all these folks in the coming presentation. Next slide. So today, the goal is the purpose to provide the board an opportunity to review and approve the 2021 proposed state and federal legislative agenda for Washington County and Clean Water Services. Next slide. So this is our path to adoption, but behind the timeline, there's been a lot of work. And since this will be our final time before you this year as a team, I hope you'll indulge me for just 2 minutes to highlight some of the work that was actually behind this timeline. Back in February at our NACO legislative conference, Paige Spence scheduled in staff meetings for HHS and housing. This is an example of identifying and maximizing an opportunity, which is critical to those departments, and built relationships with our federal delegation. We came home to COVID-19 and quickly pivoted to 3 times a week meetings. These check-ins ensured continuity and coordination among the team members and provided an opportunity for support for team members as we moved to remote work. And as you may recall, the government relations team has been remote since the first time we had a shutdown back in March. In late March, we launched a Washington County delegation weekly meeting. Aaron Doyle stepped up and took the lead in scheduling those meetings. She coordinated staff notes, provided follow-up to the delegation as needed. This is a great example of a team member building relationships with a delegation as a trusted source. By early summer, I had taken the lead to build a regional coalition, which we've been working on through the spring. In this effort, Washington County actually set the table. Rather than just joining the table or being asked to the table, we set the table to lobby for additional state and federal COVID-19 response and recovery. I think this was a critical effort as we reached out as far as Gresham, our 3 counties, city of Portland, and then many of the Washington County cities. At the same time, during late spring and into summer, there were calls for racial justice and public safety reform. Our colleague, Jajit Nagra, had direct and regular contact with the People of Color Caucus. He provided sharp and timely analysis of their legislative reform efforts and continues to do that work for the county. All of this happened against the backdrop of special sessions, legislative days, and COVID shutdowns, in addition to the work needed to bring forward this robust state and federal legislative agenda. Our federal lobby team, Steve and David, were in touch weekly, sometimes daily, sometimes several times a day, to provide updates, info, and insights on all things COVID-19 related. In all, your government relations team with 4 internal staff and 2 contract lobbyists has been committed to creating a space as a regional leader over the last year. It has been a long, challenging year at times, but I feel like we've come to today having laid the groundwork to move ahead into successful 2021. Next slide. From this point forward, I'm going to just do some highlights of slides. We have a lot to get to, and I want to make sure we have time for our federal counterparts to add some information. So this is just the slide to remind you that this was the first year that Washington County really embraced a schema that allows us to think through both guiding principles, legislative priorities, and county initiatives. So that will help frame for years ahead how the agenda is built. Next slide. So today the plan is to propose the state guiding principles for Washington County the state guiding principles and legislative priorities and the federal guiding principles for Washington County, to hear from Clean Water Services on the same issues. We're going to have time for an update from our lobbyists, and then of course questions from the board. Next slide. So proposed state guiding principles, I'm not going to reread these to you. You've seen these several times now. There's nothing new on this slide. I will highlight one or two items in the state agenda moving ahead. Next slide. Same here. These are proposed legislative state priorities. I will highlight, of course, that we're going to be identifying and securing funding for constituent relief for all COVID-19 related programs and services. We'll be continuing to look for investment in regional multimodal transportation systems, be working on workforce diversity, and of course, looking for those dollars from the state that have either been reapportioned to other places or that have been falling short the last several years. Next slide. Proposed federal guiding principles. Again, there's nothing new here. You've seen these before, and these actually have been adopted in previous years. So I'll go ahead on to next slide. Same here. I'll go on to next slide. And these are the proposed additions to the federal legislative guiding principles for Washington County. Again, bringing to the front COVID-19 recovery and relief. We've updated the international trade language thanks to Aaron Doyle's work to ensure that this actually is capturing the work we're doing today. And then health and human services, ensuring that we're providing affordable healthcare coverage to provide equal access to age-appropriate and evidence-based healthcare services, including adequate funding for behavioral health services. Next slide. Here's where I'm going to turn this over to Mark Jackers. He'll walk through the Clean Water Services state guiding principles and federal guiding principles. And then we will come back to introduce our DC lobbyists.
Good. Thank you very much, Elizabeth. Chair Harrington, members of the board, thank you for the opportunity to be here. Similar to the Washington County federal agenda, these guiding principles should be familiar to you. Also similar to the county, there are some minor changes related to COVID-related impacts. So we could go to the next slide. On the state agenda, our focus is largely on DEQ's budget recommendations related to Oregon's water quality, really focusing on up-to-date, consistent permit and fees that ensure that all Oregonians are investing in clean water. Resilient water resource management, resource recovery, renewable energy investments. The one addition there is really to monitor coronavirus relief proposals to support wastewater and stormwater and water utilities and ratepayers that have been impacted by COVID-19, similar to the efforts that you all led with our partnership with Community Action to support those ratepayers. Next slide. And on the federal agenda, it is very similar to past efforts. Our focus is squarely on the Tualatin Basin Dam Safety and Water Supply Joint Project, specifically related to appropriations to the Safety of Dams program to make the necessary seismic improvements that are needed at Scoggins Dam, which, as you know, is our region's primary water source. And we continue to work closely with the U.S. Fish and Wildlife Service related to the maintenance and operations of the Wapato Lake National Wildlife Refuge in the upper portion of the watershed. And again, with COVID-related relief programs and the HEROES Act that passed the House, there was some ratepayer assistance programs for low-income households, and we're continuing to monitor those pieces there. I just want to take the opportunity also to thank Elizabeth and her team for their help in pulling these pieces together, and to Pete Evich, who we will talk to later.
Great, thank you. Next slide. And here's where we'll have a minute to just take a breath. We've asked Steve Palmer, David Haynes of Van Squik and Associates, who represent Washington County, and Pete Evich, also of Van Squik, who represents Clean Water Services, to join us today to provide you some updates from Washington, D.C. We feel like you've heard a lot from the state lately. I'll let you know that there is a memo coming this next week from Washington County Government Relations in regards to the governor's budget to provide some updates, as well as any updates we may have regarding an additional COVID-19 stimulus package. But for now, I'd like to turn it over to Steve and David and to Pete. So Kevin, if we can make sure they're up and provide them some time to have some conversation about what's happening in DC.
Well, thanks, Elizabeth. I'm going to turn it over first. This is Steve Palmer with Vance Click Associates, and I'm going to turn it over to my colleague, David Haynes, who I believe is on as well. And he is going to give kind of a quick summary of what we've done for the county this past year. Then I'll talk about COVID relief and what's happening during the lame duck session and give a quick forecast about next year.
And pardon me, if I could jump in, since we're going to have multiple folks on the screen, are we able to take the slideshow down for just a moment during this part of the presentation? Great, thank you so much.
Thanks, Elizabeth, and thanks, Steve, and thank you, commissioners. It's great to be here with you today, albeit virtually, as we continue the Zoom meetings that we've been having as of late. I'm going to start off, as Steve mentioned, just to address some of the issues that we've been working on this year and working on with the GR team and with the county this year. Even though this year has been a challenging year that we've all experienced in different ways, I think our partnership has been effective in our efforts through advocacy and analysis and communication and intelligence as well. I think first, it comes to nobody's surprise that COVID-19 continues to be a major area of focus in Washington, as well as in our advocacy efforts. This year, we've definitely focused on advocating for additional county resources and the need for additional funding for areas impacted by COVID-19, such as direct COVID health impact and also impacts areas such as housing and public safety as well. This effort, as you've heard about as well, led alongside the county's GR team to organize advocacy that brought together the surrounding cities and counties across the region, a unified voice for COVID-19 advocacy. We've also, during this work, we've worked with the county's congressional delegation and various stakeholders and congressional leadership as well to try to meet the county's needs. We are currently actively working on advocating to ensure the county will have access to additional direct flexible funding for COVID responses, as well as advocacy over the last few months for flexibility with the Coronavirus Relief Fund. And you'll hear some updates on that from Steve as well here in a little bit. But throughout the pandemic, we have continued to advocate alongside the National Association of Counties, or NACO, to address Washington County's COVID relief needs as well as other needs. And we also continue to work on Washington County's other needs as well, including the FY21 appropriations. We worked with the county's GR team and the congressional delegation, and as well as the appropriations committee on federal appropriations priorities for the county, such as areas such as housing, affordable housing, and public safety, transportation, and infrastructure, and even funding that helps address our community health needs, including that of our seniors as well across the county. Even with the emphasis on COVID-19, as I was discussing, we're also working as well on the other county priorities. And we're working with the department heads, the GR team, to continue to advance the county priorities, areas such as affordable housing, improved transportation, and infrastructure as well. Second, I just wanted to highlight, it's been great to work with the county government relations team to quickly understand the evolving environment that we've been experiencing this year, including the specific impacts on COVID and the COVID relief bills as well that we continue to see this year. And lastly, wanted to just highlight the communication aspect of our continued relationship with the county, and that we've provided regular reports and intelligence throughout much of the year on the issues I've been highlighting, COVID-19 appropriations, the other issues as well that have come up between. So throughout all this, we are grateful to continue our partnership with Washington County with that said, I'll turn it over to Steve to discuss some of what we expect to see in the coming weeks and months.
David, thank you, commissioners. It's a pleasure to be here today with you. As David said, what I'd like to do is just kind of give you a snapshot in time of where we are right now with the next COVID relief bill. And then briefly talk about where Congress is heading with the last appropriations bills to keep the government functioning for the rest of the year, and then a brief forecast of next year. So to talk about the COVID relief bill right now is incredibly fluid. I could have told you on Friday one thing, this morning another, and now this afternoon a third. As of right now, the Senate is working, as you saw last week, right after Thanksgiving, a group of 6 bipartisan senators got together and came forward with a proposal for $908 billion in COVID relief. The bill, that number seems to be sticking. No one wants to go any higher. There is a great deal of support for a bill that would include funding with direct financial assistance for state and local governments. And the proposal as it stands right now would be $160 billion out of that 908 for COVID relief, or for state and local financial assistance. And of that 160, 20% would go to counties, or about $30.4 billion. This is not etched in stone by any means, so this still all could change, and it all could fall out of the bill, for example, to that point. What they're proposing is, of that $30.4 billion, 1/3 of the money would be distributed by population, and then 2/3 would be distributed by lost revenue. So they're trying to come up with a formula that works for the majority of counties, and they know that the CARES Act didn't provide enough direct financial assistance for the majority of counties. Washington County did get direct allocation of funding, but many counties and cities did not. So that's what the proposal of this group is really coming forward with. They would also provide, extend the coronavirus relief fund from the CARES Act for another year so that money could be used, carried over into the next year. And there would be a limitation on preventing it to be used for pension liabilities, which was similar to a proposal that came out earlier this year. We were calling for the SMART Act because it was proposed by a number of these same senators. Now, I should say, while there is growing support for this, President Trump has said he would sign the bill, a bill. President-elect Biden has said he supported this. The Senate Majority Leader, Mitch McConnell, has yet to express his support. And it's important because he schedules all legislation that comes to the Senate floor. The sticking point, again, continues to be this direct financial assistance for state and local governments. He'd like it to be tied to very broad liability limitations on businesses that reopen during COVID. And I think they're trying to find a compromise for that. And then if they can, they'll move forward with the bill this week or next. But it's a great unknown. Those last two issues, the liability and the state and local funding, are the two that are not yet finalized, and they're being drafted. So I want to emphasize that. And they may not be in any bill that comes forward to the Congress. How do they keep the government open? So the current funding runs through this Friday, December 8th. 11th rather. They realize that they're not going to finish it by Friday, so they're going to extend the government funding for another week, or what they call the continuing resolution. And the issues there are the ones that you could predict. What is causing the delay? It's funding for the border wall. It's funding for police anti-racism training. It's funding for limitations on the sage grouse by the Department of Interior. And so there are a number of controversial issues that are holding up the legislation. And then looking ahead to next year, obviously the agenda is still somewhat sketchy because we don't know, today's the day, the safe harbor date for the Electoral College. And until today, really it wasn't clear exactly how things would proceed. But, the President-elect Biden has said infrastructure is going to be a priority of his, and he wants a bill on the House floor as early as possible next year. The great concern, though, is how that will be paid for, because included in that is funding for the surface transportation reauthorization legislation, and that as proposed this year was about $500 billion. If they bring forward the same bill as they did earlier this year, the $1.5 trillion Moving Forward Act, there's going to be some pushback from congressional Republicans about how to pay for it. So there's a concern about that. The COVID relief and vaccine funding will continue into next year, as will be a stimulus for how to get people back to work. The one bit of good news I'd say for the county is that earmarks do seem to be coming back. There's no ironclad guarantee yet, but there have been many strong statements by the new chair of the Appropriations Committee, as well as the chair of the Transportation and Infrastructure Committee. So the House plans on bringing back earmarks next year only for public entities like the county. And there will be very strict guardrails and limitations put on about how those earmarks will be requested. So no idea yet how much, any guidance from the Congress, how much they'll consider funding or what kind of information can be provided. But I think we'll learn that in the coming weeks and to come, and we'll work with the county on that. So with that, happy to answer any questions you might have, and Madam Chair and other members of the board, and then we'll turn it over to Pete.
Great. Thanks, Steve. Can everyone hear me okay? All right, good. Well, Chair Harrington and fellow commissioners, thank you for affording me this opportunity to provide you with a brief update regarding Clean Water Services federal priorities and advocacy efforts. As you are aware, and Mark had pointed out, our #1 federal priority has been the advancement of the Tualatin Basin Dam Safety and Water Supply Joint Project. Thanks to the leadership of Washington County's congressional delegation, Rep. Bonamici, Senator Merkley, and Senator Wyden. The fiscal year 2020 congressional appropriations bills contain $2.5 million within the Bureau of Reclamation's Safety of Dams program to advance pre-construction activities for the Scoggins Dam project. So once an omnibus measure is finalized, as Steve alluded to, we're hoping that, fingers crossed, in the next week or so, this additional appropriation will bring the federal funding for the Scoggins Dam project to $13.5 million over the course of the last several years. In terms of keeping the project on track, one of the most significant issues moving forward is ensuring Reclamation's Safety of Dams program is adequately funded. Over the next decade, a number of high-dollar Safety of Dams projects will be coming online concurrently. The current estimate is that these projects will cost approximately $2.5 billion to $3 billion for Reclamation to complete. With current annual budgeting for Safety of Dams program being at approximately $85 million a year, if those levels stay constant, it would take Reclamation 20 to 25 years to complete the Scoggins Dam Tualatin Basin project. So we've highlighted this issue with Washington County's Oregon congressional delegation and the impact that inadequate long-term funding for this program will have on the completion timeline for Scoggins. We are pleased they requested of the administration to increase funding for the Safety of Dams program in its annual budget submission. Additionally, they plan to team with the California congressional delegation in future advocacy efforts to increase funding for Reclamation sod program. This is because California is also very interested in the financial condition of the program, because the BF-Sis Dam in the Central Valley of California has a $1+ billion safety retrofit that's underway with Reclamation. So BF-Sis and Scoggins are the two largest sod projects which Reclamation is prioritizing over the current decade. We're also helping the Oregon congressional delegation identify other state delegations which have upcoming dam safety projects in the works within the sod program. So building as broad of a congressional coalition as possible on this effort can be a helpful element to achieving the needed funding increases for the program over the long term. Strategically, we'll be working closely with the Oregon congressional delegation as future legislative initiatives such as a federal infrastructure package come to the fore in the next Congress, a sizable infrastructure bill, or some other type of emergency spending package represent the kind of opportunities where supplemental funding could be added to the sod program. Over the last year, we've also been advocating for federal financing mechanisms, which could be accessed to help fund any additional benefits portion of the joint project that may advance. We've been supportive of efforts to continue an existing reclamation water storage grant program, as well as the creation of a reclamation-based version of WIFIA, which is the federal low interest loan program for large-scale water infrastructure projects. While the efforts associated with advancing the Tualatin Basin Joint Project are the priority focus, as Mark alluded to, other issues of importance have also been on the radar screen. He had mentioned the COVID relief legislation, the HEROES Act, which included the establishment of a water utility low-income ratepayer assistance program. However, as we're looking at this final COVID relief package that Steve had talked about and Congress is currently working on, we know it's going to be trimmed down so that the ultimate fate of this low-income ratepayer federal assistance program is uncertain at this point. Not to reiterate too much, but as Mark had mentioned, working closely with Fish and Wildlife, continuing to make the Oregon congressional delegation aware that adequate annual maintenance and operation funding in support of the Wapato National Wildlife Refuge is another priority. Additionally, we've been supporting efforts for increased funding for federal water recycling and reuse grant programs, as Clean Water Services may look to access those accounts in future years. And while we've had ongoing communications with the Oregon delegation staff throughout the year, we decided in lieu of our annual in-person DC fly-in, Clean Water Services arranged virtual meetings with the offices of Rep. Bonamici, Senator Merkley, and Senator Wyden this past summer. This gave us and the participating repayment partners the opportunity to thoroughly brief the staff on the status of the joint project, as well as cover other federal water-related priorities. As you are aware, throughout the years, your congressional delegation has been extremely supportive of the county's specific efforts and requests associated with advancing the Scoggins Dam project, and this year was no different. Their receptivity and responsiveness to the issues surrounding the project is always greatly appreciated. And then, of course, we'll continue to stay closely engaged with them on project developments and near-term needs as we head into the new year. I also wanted to note that this past August, Washington County, Clean Water Services, and the Tualatin Repayment Partners, Chair Harrington was part of this meeting. We had a very productive meeting with Reclamation Commissioner Brenda Berman, Deputy Commissioner Shelby Hagenauer, and other high-level reclamation officials in DC. Commissioner Berman and other reclamation officials highlighted the near-term safety of dams program funding crunch and expressed appreciation of our efforts to educate and enlist the Oregon delegation in support of sustainable funding for the SOD program. Reclamation officials are concerned about meeting the dam safety program's demand, and they are looking at opportunities to bring more funding to the program in the coming years. In addition, we talked to Commissioner Berman about the schedule of the Scoggins Tualatin Basin Joint Project. She highlighted that Reclamation has been working on this project for a long time, expects the agency to keep working on it until it crosses the finish line. Lastly, we have the soon-to-be President Biden administration means there's going to be a change in leadership at the Department of Interior and Bureau of Reclamation. We expect to hear shortly on President-elect Biden's choice to lead Interior. Interestingly, all the potential candidate nominees we've been hearing about hail from the state of New Mexico. In terms of the Reclamation Commissioner, no word yet on potential candidates. As you're aware, Senator Wyden serves on the Senate Energy and Natural Resources Committee, which is the committee that will hold hearings and have the first votes on Department of Interior nominations. So he'll, of course, be very engaged in the process to advance those cabinet positions. So with that concludes my remarks, and we look forward to any questions you may have of us. Thank you very much.
Great. Thank you, everyone. So Chair Harrington, members of the board, we've got about 15 minutes left of our 45, and you have the full state team from Washington County, as well as our federal folks and Clean Water Services here to answer any questions or have a conversation.
I have
Commissioners, any questions or comments? Oh, go ahead, Commissioner Rogers. Sorry, I didn't see you.
That's fine. I have a question to Peter. That wasn't a very heartening presentation regarding the dam. I know it's factual, and I appreciate your efforts. You're doing a good job, but it sounds like the funds are so small and the queuing is so long, and you've indicated there's going to be some new appointments that might make it even more difficult for us. Are you, with our folks, coming up with some strategy to deal with this in the future, or do we just continue to run against the wall with our head and trying to say that that's the only alternative we have is to go through the Bureau?
Well, I apologize, Commissioner Rogers, for sounding so negative. I mean, I think the fact that Reclamation is so sensitized to this, and we've actually been told by Reclamation it's the year fiscal 2023 where they really see, when they start to see the crunch time hitting with that BFSIS project and then other projects coming online. The good news is we're not the only entity that is aware and is advocating for a more robust long-term funding for the Safety of Dams program. As I mentioned, it's going to be extremely important for the California delegation. That project there is water that's for the farmers. That BFSISC is a very important project for the state of California. So I do think there's going to be opportunities. As I mentioned, there's an infrastructure package that will be likely emergency spending. We've been strategizing about not only having a large injection of funding to the Reclamation Safety of Dams program, but for, say, the Army Corps of Engineers Safety of Dams program, FEMA's dam safety program. All of these programs are getting stretched. So there's strategically working in coalitions. We think that over time we're going to be able to get that. And Reclamation is also pressing from a budget perspective and trying to get more funding, and they're doing some reprogramming internally. But we need to be, keep working on that issue.
Peter, just a quick follow-up. Catherine, you're on mute.
Yep. Could I ask our CEO, Diane Taniguchi-Dennis, and Mark Jockers to interject at this point as to when the board might receive an update on financial strategy moving forward? I know we will have such a thing in 2021. I just don't know the time frame, but the team has been working with the Bureau on financial schemas and so forth. And I want to make sure they have an opportunity to let you know when we should be expecting further information on that beyond at the federal funding level.
Yes, thank you, Chair Harrington, Board of Clean Water Services. We anticipate coming to you in the first quarter of 2021 to talk about two things. One is the project itself and its alternatives. As you're aware, the alternatives came in at a much higher cost than we anticipated for all options, and in particular, the downstream dams. So there are significant financial implications, but there's also the reality of what we need to do technically to ensure that Clean Water Services can meet its regulatory compliance needs well into the future for the region as it relates to thermal control and water quality. So we'll be bringing you two discussions. One is a discussion on the alternatives and the technical needs as it relates to regulatory compliance and other water needs in the region, and then also a conversation on the project costs. There's also an economic study that is currently being conducted to make sure we understand the economic impacts of water in the region, as well as the impact should alternatives need to be deployed to deal with this time period in which the dam has not been seismically retrofitted yet. So it's this interim period between the project on safety of dams and how we're going to manage through potential earthquakes during that time period. So lots will be teed up for the board. Thank you, Chair, for introducing that.
I just have a couple of thoughts and just some information I wanted to share, which may or may not be useful. I don't know. But number one is I'm wondering, California, frankly, has been all in on one side of the party equation. Something like out of the 7 million vote margin that Biden has, in terms of the popular majority, 5 million comes from the state of California alone. So that's a state that has really sort of put all its chips on one side of the party roulette table, I suppose. I'm hoping that maybe now that there will be a Democrat, at least for the next 4 years, that maybe California could be really a useful ally with us, and obviously a very powerful ally. Just wondering if the change in leadership and given the politics of the West Coast, and particularly California, if in fact that can really be very fruitful to work with California on their project to get the funding that both these dams and other dams need. So that's number one. Just some, what's our lobbying view? Is this election meaningful in terms of California's much more powerful role in the Congress and in the administration? And number two, just a little sidebar. I noticed that the BF-Sis Dam, I guess is also known as the San Luis Dam over near Los Banos. I used to drive by there all the time on the way to school, actually, but I know the congressperson who represents that area. He went to my high school, in fact, in my class, and in the San Joaquin Memorial High School band, I played clarinet. He was the trumpet player. Jim Costa. I think we're doing a class reunion in April. We couldn't do it this year. It was going to be our 50th class reunion in 1970. So if I could be of any use at all in just whispering in Jim Costa's ear as a past alumni of San Joaquin, in fact, as a member of the band with him in my freshman year back in San Joaquin Memorial, I'd be happy to do that. So just a little sidebar. I don't know if that's a card that's even worth playing, but I felt remiss if I didn't point out that I actually know, as a classmate from high school, the congressperson who represents the BF-Sis Dam.
Yeah, I doubt that would be helpful. I think he would also just find it interesting, the synergy related to the Scoggins Dam and what they're trying to do at BF-Sis. And interestingly, they're also trying to do a joint project effort with San Luis Dam, BF-Sis, in terms of Delta Mendota, which is in his Costas district. They're looking to potentially, raise the dam after the sod program gets completed first. So that would be really, I think, sure, that would be certainly helpful. And to your other comments, I think yes, I think what's occurred is going to be helpful from an administration standpoint. I also didn't fail to mention that we also are fortunate, strategically placed in that Senator Merkley serves on the Appropriations Committee, on the Energy and Water Appropriations Committee in particular, which funds the Bureau of Reclamation, and the ranking member, and both of them could be on the majority side after January 5th. She's the current ranking member, could be chair of that subcommittee, Senator Dianne Feinstein of California. So both of them are on that spending panel, which funds the reclamation and the sod program. So there, with their help, you could always continue to increase above the budget amount. But if anyone wants to add to that, Mark or.
No, thank you, Pete. That's good. Commissioner Scott, we will get you a briefing paper before your high school reunion that you can slip into Representative Costa's pocket when you're there. So thank you for that offer.
Well,
Just out of curiosity, it would be easy enough to check, but I'm just curious, what committees does he serve on, and do they relate to this issue?
Yeah, he's on the House Natural Resources Committee, so he's extremely focused on water issues. He's very good, and he actually was up to be potentially the chair of the House Agriculture Committee. This for the 117th Congress, they gave it to somebody else, but it was between him and another member. So he's high ranking on ag as well.
Yeah, that wouldn't surprise me. That's obviously a very ag-oriented part of California.
Right.
Yeah.
And I don't think our team needs to hear this from me, but I would ask the team to please pass that personal information from Commissioner Skouten on to our federal delegation, because it may be those little personal antidotes that help them strengthen or create a relationship that they may not have yet. So thank you, Commissioner Skouten, for mentioning that. Commissioner Rogers, I thought you had another potential question before we segued over to Commissioner Skouten.
No, thank you.
No?
Thank you, Diane. No, that's fine. I was just going to ask Peter if he were a betting man, and please don't perceive your negative presentation as bad. I love to know the real answer. If you were a betting man, when would you see funds coming our way?
Well, that's
a big money.
That's I think what I was highlighting is making sure that program is adequately funded. So when we're in line and ready to go from a construction standpoint, there's enough funding for CISC and there's enough funding for our project. I think that in terms of the schedule, I know that's something that is, maybe Mark, you can comment on that, or if that's something for the future presentation.
Yeah, I could just briefly comment on that, Commissioner Rogers. In our conversations with the Commissioner Berman that the chair was in on, we were looking at the funding for BF-CISC is looking at going over the next 8 years, roughly through 2028, 2029, with the idea that the larger tranche of funding associated with the actual work at Scoggins would come in that 2029, 2030 window. In the meantime, we continue to get annual appropriations associated with the work being done to look at which option to move forward with. And then concurrent with that is the issue that Diane mentioned, which is we need to have the conversation with the board about both the project update, but also how do we finance this project that has become, frankly, too expensive for both the federal government and for the local folks here. But it remains a priority on both of our behalfs, because this is one of the most seismically threatened facilities in Reclamation's entire inventory. So they see it as a very high priority that they do need to do something about. And it's a very priority for us, since it's our primary water source, both drinking and ag and for our compliance needs of clean water services.
Commissioner Treese and Commissioner Willie, any questions or comments? So Commissioner Treese is good. Commissioner Willie, anything? Okay. Well, I have a couple of things. First, a detailed question with regard to the Bureau of Reclamation. Everything that I've heard from the team, particularly Mr. Evich and Mr. Jockers, about our relationship with the Bureau of Reclamation under Commissioner Berman has been very positive. Now, I don't recall her tenure timeframe with the Bureau, so maybe you experienced a change of leadership prior to the Trump administration. I don't know. Is her being replaced as the head something that is pretty much guaranteed, or might we have the pleasure of continuing to see her leading the Bureau moving forward?
Just quick comment. She is a political appointee,
Yeah.
so her last day is on January 20th.
So
As
that's
is-
assured.
Yeah. So as is actually Deputy Commissioner Hagenauer. She's one of the 3 deputy commissioners that's a political appointee too. But you're right, Chair. We've had a great relationship with Commissioner Berman, and she was, as you recall from the meeting, she was very committed to the project, very frank and forthright conversation. So, from the commissioner standpoint, if she was going to be there for another 4 years, I think that would have, she's committed to the Safety of Dams program. She, so that means a lot to her. So I think, from some, from that high level in terms of having an interior secretary that may have a better relationship with our senators, maybe as the project gets down the line and we have to, I think that could be, maybe where I think we were going with the earlier questions. But I think at the commissioner level, we've always had very good relationships with the Bureau Reclamation Commissioner and their staff.
So let me have you checkpoint an assumption on my part. I'm assuming that with a change of administration, that puts an additional task on the plate for you folks at Vanscoy, as well as for our team, Mark and the other members, Diane and the other members of Clean Water Services, to connect and develop a relationship with the new political appointees. If that is the case, I don't want it to be lost in my head that is something that will require an investment of energy and time on your part.
It certainly will, Chair. We have gone through multiple administrations on this project over the last 18 years. I think the strength of our relationships are really built upon the high-level senior staff relationships we have. We have a very close relationship with the Safety of Dams, the director of the Safety of Dams program, Bob Pike, as well as his predecessor, who is now a director over the Safety and Security program, Karen Knight. Their legislative staff. So those are relationships we've had for a long time. We also continue to have a team of people advising us that are former reclamation employees, including a couple of former commissioners that have also been providing some counsel to us on strategy on this work.
Good to know. Thank you very much. So my last comment, or the last thing that I have for you, is just a comment, not a question. I really want to, oh, no, it turns out I do have a question. Sorry, I had to look back at my notes. But before, well, I'll get to it, the question then first. So I've been watching NACO information over these last 8 months of, having had the benefit of attending the NACO conference for the first time back the end of February, beginning of March. So being more aware of NACO. I haven't invested in being connected with NACO myself, but I've been wondering, as I have looked at information from NACO, from other counties, especially during COVID, there are various counties throughout our country that have made presentations to different forums at NACO, different webinars and so forth. And I assume that some of that information is useful to the congressional delegation. So while I know we've really tried to be supportive of our staff to do all that they can and work hard to get those resources from the full CARES Act fund, not just the CRF portion, but the other emergency funding and public health dollars that the departments, the federal departments have provided to really follow through and get those dollars into action in our community. Our government relations team, based here, has been very selective about tapping into our departments to try and get some of these stories along the way. But they too have been incredibly patient in waiting until, I'd say, the early part of the year to gather more of those stories and to put together a comprehensive report, because it's taken a ton of work to get these dollars out the door and into the community. But my question for you, really at to the Vanscoy folks, I'm wondering, have we sourced our staff, whether it's the Washington County, well, specifically the Washington County team or you, have we sourced you sufficiently to be able to tell our story moving forward, both for our federal delegation as well as to even our NACO partners? Or is that something that I need to be more mindful of moving forward? I know that's a pretty open question, but
if I could first jump in here, I know we asked that Vanscoy, but I do want to highlight that at the direction of Administrator Angie, that Aaron Doyle and a whole team of folks from Washington County are actually in the process of building that very thing. So we're on a short timeline to do a rollout early in December, and then with a focus on public health, critical needs, and then we'll continue that storytelling into the new year. Around business, around other things. And I think that I expect that Aaron Doyle will be working with David and Steve to ensure that we're connecting those stories with our folks at NACO. Chair, to your point, I will say that about 6 or so weeks ago in a conversation I had with one of Wyden's staff members, the first question he said to me is, have you reached out to NACO and what are they doing to lobby? Because given the politics at the moment, it was going to take someone like NACO to step in to shift the conversation. So, but I'll step back from that, and either Aaron or David or Stephen, if you have something to add.
I'll go ahead and jump in. The answer, I think, is yes. The story of Washington County has been very helpful to be able to take to DC, and we have had a strong story to tell both to NACO as well as Congress. I think in two areas that I could highlight that would be, the simple one is on the COVID side, and taking the story, the impact to Washington County and bringing that to NACO, and then having them have that ammunition, if you want to use that word, or that information to be able to take that to Congress administration as well and have that conversation. In addition to us taking that information as well to Congress and the administration, has been very helpful. Another area that I can point to is connecting NACO with the department heads on infrastructure, a potential infrastructure bill, and also the transportation reauthorization bill as well this year. And having that story of Washington County's needs connected with the NACO staff, and having them be able to retell that story as well of Washington County's needs, I think has been helpful. But any time that the county is able to provide us with that information is incredibly helpful, because in turn, we're bringing that to Congress as well. So moving forward, we welcome that continued storytelling and that continued narrative as well.
We have a great GR team, but I just want to remind all of you, both you DC-based folks as well as the county folks, that for moving forward with NACO, please do reach into the full board for helping contribute to the visibility on that. I trust that you have been, and I know you will continue to do what you think is very effective, but I know that you have a very supportive board and willing to be virtually present to help ensure that there is the facial connection for telling those stories and participating. So Thank you very much, team, for
Chair
that.
Harrington, if I may, I'll just say very quickly, this is Steve Palmer, very quickly that that's really helpful and it's really important next year because as you know, and we'll see again in January, the beginning of a new presidential term is always one of the busiest times in Washington because there's a new agenda, a new Congress, and there'll be a lot of activity. So having that information would be incredibly helpful.
Yeah. I did want to share the comment that I'm really appreciative of the quality of this team. You're a very strong team. I know that you've done a lot of work together. There's been a lot of collaboration, a great deal of partnership. I'm really impressed with all 8 of you and appreciate the work that you have done, the accomplishments to date. It's a really it's a strong sign of excellence. All of this work that you've done to put these stories together, to advocate the relationships that you've built, not only with our federal delegation and administrative departments, various departments at the federal government, but also state legislators, current as well as incoming, and the schema that you've all put together for us in our action on the state and the federal agendas for Washington County and Clean Water Services. Thank you very much for that excellence. I really, really appreciate it.
Thank you.
Let me just double check. Are there any other commissioner comments or questions before we move forward with the action to adopt these agendas? Okay, not seeing any then. So we have before us today these agendas for adoption. I'm interested in hearing if the county commissioners are interested in making a motion to adopt both the, well, I'll just deal with it as the comprehensive set.
Move to adopt both the federal and state legislative agendas.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Aye. Any opposed? The motion carries unanimously 5-0. Congratulations, team. We now have an adopted agenda, federal and state, for Washington County and Clean Water Services. Thank you very much for your excellent work, and thank you all for staying healthy. And I know we look forward to our continued work together in 2021.
Thank you so much.
Thank you, Chair and Board. Thank you.
Thank you.
Thank you, everyone. Have a good afternoon.
All righty. Next on our agenda is oral communication. Mr. Moss, do we have anyone signed up to speak during our second oral communication period?
Yes, we do, Madam Chair. We have Mr. Dale Feek. Dale, can you hear us? Dale, can you hear us?
Yes, Kevin, I can hear you. Can you hear me?
Yes, we can. Please go ahead for up to 5 minutes.
Thank you. Representative and just Commissioner Feek, Chair of Washington County Citizen Action Network, WCCAN, quality of life in Washington County, vital on economic justice and open and responsive government. I'm going to change my order. I had 3 things I want to talk about, but based on what I've heard to the work session and the commission meeting today, I'm going to change my order and put 2 more things on my public comment. I'm also entirely impressed with the federal congressional district now, our federal congressional delegation, which should have more power and influence at federal legislative levels now. And I'm glad that all of you are working with our congressional delegation. And it's appropriate that you as a county have now hired 3 directors of legislative stuff. I'm much impressed with the direction that they're going and the competence that you've hired in those 3 that have been on this call, at least visually, and I've seen their pictures. So thank you for having that team so effective. I also want to comment based upon the water needs of Washington County. As you know, I've been involved in industrial polluters in the county for years, and also the amount of water and electricity they use of a lot of things, but because Washington County water, because Intel uses billions of gallons of water a year, as do other industrial entities in Washington County. So I'm glad that Intel is aware that they're not going to get as much water as they thought they were going to be able to get, and they developed a $600 million wastewater treatment plant, which should help reduce the amount of water that they demand from Hagg Lake and other water resources. That's my first comment. Second comment is City Health and Department Services under the direction of Marnie Kyle. I'm just so impressed with what they are doing and the team that they have, information they give to you as county commissioners and also us as the public. I just wish more public listen to the presentations. I'll do my best to have more people get on and listen to your deliberations and learn from them. Now to my 3 comments I want to make before I listen to your comments. I sent to you as commissioners a document about Tightrope, Nicholas Kristof's book and film documentary about how the underserved need help and they can't pull themselves up from the books, up from there, by the make sure that the need a lot of help. You're putting in that. I'm in communication with Nicholas Kristof. I gave Chair Harrington 2 books about that, and I'm encouraging her to share them with the equity officer for the county. Number 2, the Environmental Quality Commission met Thursday, December 3rd, and they had a presentation from DEQ staff to the Environmental Quality Commission about recycling. Recycling in Oregon has to change, and they are the people that know the most of how to do that. And I encouraged you to have them come make a presentation to you on a work session. I hope you will follow through with that. And I gave you information how you can do so to your chief of staff and other people. And I included in that the 2 sustainability staff people at Washington County. Third thing, and I have 57 seconds. I can get done with this, I'm sure. Third thing was significant natural resources ordinance 869. I noticed that General Counsel Alan made a comment about my written comment to you. And so I would just encourage you to take a look again at what Fran Warren and other people have made public comment about significant natural resources. And it appears like you can go forward and accept permit applications on December 15th. I don't think you should. I think you need to do a little bit more research and make better decisions on that. But that's my point of view and others. So please take a look at what I sent you. Have them do a significant, please take a look at what I sent you in my other written emails. I appreciate the opportunity to work with you and make public comment. Thank you.
Thank you, Mr. Feek. Kevin, do we have anyone else signed up?
We do not, Madam Chair.
Okay, thank you. Next on the agenda is board announcements. Just want to make sure that everyone is aware that we will have our pair of meetings next Tuesday, December 15th, with an afternoon work session starting at 1 p.m., I believe, and an evening meeting starting at 6:30 p.m. Then We're going to be having a special meeting, a board meeting on December 22nd, once again, a Tuesday. That is slated for 10 a.m. Then after that, we're into the brand new year. And our first business set of meetings in 2021 will be on Tuesday, January 5th. We will have a new Board of Commission member for our work session at 8:30 and our board meeting at 10 a.m. At that board meeting, following our rules of procedure, we do have one convening action we need to take, and that is to appoint our new vice chair, which, following the rules of procedure, would be our own Commissioner Treese. Then also that week, we will have a roundtable meeting that is currently slated to start at 10 a.m. So are there any other board announcements for today? I do know that we have a special celebration and send-off for Commissioner Dick Scouten on Thursday, December 17th. I believe that time is set for about 11 in the morning, if I have that right, or someone can correct me, who may be looking at their calendar and I'm not. So, Commissioner Treese, you had something to add?
I'd just like you to mention that we have the session this coming Saturday for the public on the COVID discussion.
Yes, Commissioner Treese is ensuring that we announce that there is our second COVID town hall of the year. We had our first COVID town hall back, I think it was May 11th or so. And with all of the new disease reopening metrics, as well as brand new information on vaccine next steps, we've thought that we would do our part as a Board of Commissioners and have a town hall on Saturday, December 12th. And I believe that will start at 10 a.m. and run for an hour and a half. We have that information posted on the Washington County calendar, as well as on social media. It will be in another virtual YouTube and Zoom sort of event. Did I get any of that wrong? Ms. Angie?
Just to clarify, Commissioner Scouten's event starts at noon on the 17th.
Okay, thank you.
Okay, that's good to know. I had it at noon. I just switched it to 11. I'll switch it back to noon again. Okay.
Yeah, I see it's an online event running noon till 1:30. And let me just see while on camera too. It isn't listed currently on the Washington County online calendar. So I'm not sure about that, if it's by invitation only or what.
We'll ensure that gets added to the calendar.
Okay. There's also the Zoom, or the logistics for the town hall are published right on our homepage. That's co.washington.or.us. Are there any other board announcements that folks want to make sure we highlight today? Commissioner Willis?
Just for clarification, Chair, going back to the town hall, I've got a Zoom meeting from 9:30 to 12:30, and then I've got a TBD from 10 to 12. So one has a Zoom address and the other one doesn't. So Kevin, can you clarify that for me?
Yes, I can, Commissioner Willie. So your town hall is scheduled from the 10 until noon on that Saturday. The 9:30 was just to ensure staff and the community partners have time to get on there to prep before it starts at 10 a.m.
Okay, so that's where I would go to. There we go. Okay. Okay,
Yeah,
so
so
that's
they
where I
get
would.
us all set up so that
Okay,
we can go live at 10.
perfect. Okay, thank you.
Great. Anything else, commissioners? Okay, well, that's it for the agenda. Do we have a motion to adjourn today's business meeting? And then we would reconvene in an hour at, we have speakers coming at 1, so we probably need to only take a 45-minute lunch. Is that okay, commissioners? Okay, we'll make it work. All right, do we have a motion to adjourn?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries. Our Tuesday, December 8th, Washington County Board of Commissioners meeting is hereby adjourned, and we'll reconvene in our work session at 1 o'clock. Thank you, colleagues.